My name is Jim Kennedy, and I'm an emergency physician from Oklahoma, and I'm receiving an MPH in Health Policy and Management. Well, I originally became interested in public health. Over the years, working in the emergency department, it became obvious to me, while seeing patients, you see patterns, and while a significant portion of my patients were in the emergency department, they had real medical emergencies, it was obvious to me that their problems were rooted not so much in their health care, but in a lack of health, a lack of wellness, a lack of prevention, and lack of understanding of the disease and their disease process. Before I came to the Harvard School of Public Health, I was an emergency physician working in various areas of emergency medicine. I practiced in very small ERs, in community ERs, in large academic centers and tertiary care centers, as well as the military. And I developed this interest in public health, and I knew I needed to broaden my skill set. So I started looking around at public health schools and where would be the best place to learn the skills necessary to create real change in the world. And Harvard School of Public Health fit the bill. It's probably one of the most valuable skills I've learned at the School of Public Health, in addition to learning all the nuts and bolts of how to take care of public health issues, but understand the importance of people and relationships and how important it is to nurture those relationships with people in the community, people in hospitals, and people outside of medicine and public health itself. After I graduate from the Harvard School of Public Health, I hope to return home to my home state of Oklahoma and continue practicing medicine in a part-time capacity while trying to expand my skill set as far as public health. I think understanding public health on a local level is so critically important. And so I plan to work with local public health officials in my home state, and then try to understand other forces that act on medicine that also have an effect on public health.